Every day, millions of seniors rely on prescription drugs to manage chronic conditions, reduce pain, and maintain independence. These medications are lifelines, but only when used correctly. The problem is, the smallest mistake in how you take them can lead to big consequences. And most of the time, it's not about the wrong medication. It's about the wrong habits around it. Maybe you felt dizzy after taking a new pill, or your blood pressure hasn't improved despite strict compliance. Maybe a friend told you to try cutting your dose in half, or to take 2 instead of 1. It seems harmless, until it isn't. For seniors, the risks of making a mistake with prescription drugs are higher than ever. The body becomes more sensitive with age, organs process substances more slowly, and juggling multiple medications at once opens the door to complications that can affect everything from your balance to your breathing. Here's the truth. Most medication mistakes don't come from carelessness. They come from confusion, misinformation, and assumptions. You might think generics are always identical to brand names, or that if a drug works for someone else, it will work for you too. Or maybe you've been using a leftover prescription from last year, assuming it's still okay. These aren't rare errors. They're common. And they can quietly sabotage your treatment, making you feel worse instead of better. In today's video, we're going to unpack the 7 most important prescription drug mistakes seniors must avoid. We'll break down each one, not to scare you, but to show you how small, smart changes can protect your health, improve how your medications work, and help you feel more in control of your care. You don't have to become a pharmacist overnight. You just need to understand what really matters. Have you ever wondered if you're really taking your medications the right way, or if something you're doing could be interfering with your recovery? You're not alone, and by the end of this video, you'll know what to avoid and what to do instead to make sure your medications are working for you, not against you. These next few minutes could be the difference between guesswork and clarity, between side effects and steady progress. Because when you understand the most common pitfalls, you can avoid them, and that knowledge is one of the most powerful prescriptions there is. Let's get started. Mistake number 1, skipping doses or taking too much. Among all the prescription mistakes seniors face, none is more common or more quietly dangerous than skipping doses or taking too much. It seems simple enough. Take the medication as prescribed. But when life gets busy, memory slips, or confusion sets in, that simple step can become a minefield. Let's start with skipped doses. Maybe it's forgetting a morning pill because the routine changed. Maybe you were feeling good and didn't think you needed it. Or maybe it just slipped your mind completely. It happens. But the consequences depend on the type of medication. For some drugs, missing 1 dose isn't a big deal. For others, like blood pressure medications, heart drugs, diabetes medications, or antidepressants, a missed dose can reduce the drug's effectiveness or lead to a sudden drop or spike in vital signs. Even more dangerous is the temptation to double up on a dose after missing one, thinking it will catch you up. This can lead to unintentional overdosing. With drugs like blood thinners, painkillers, or medications for anxiety and sleep, taking too much, even once, can be harmful or even fatal. It's not just about the dose being too strong. It's about how your body processes that chemical load all at once, which can overwhelm your liver, kidneys, or nervous system. And then there are those who take too much without even realizing it. Maybe the pill bottles weren't labeled clearly. Maybe you forgot you already took it earlier and took it again. Or maybe a spouse set out the dose for you and you doubled it without knowing. These aren't far-fetched stories. They happen daily, and they often go unrecognized until side effects show up. Dizziness, confusion, stomach upset, sudden fatigue, or in serious cases, hospitalization. The reasons behind these mistakes are often innocent. Memory lapses, vision issues, multiple prescriptions with similar names, or vague instructions like take as needed, all of these increase the risk of dosing errors. And for seniors managing 5 or more medications, the math becomes even harder to keep track of. So how do you prevent it? The first line of defense is routine. Taking medications at the same time each day, ideally tied to daily habits like meals or brushing your teeth, makes it easier to remember. Second, simplify. Use a weekly pill organizer with labeled compartments for each day and time of day. Some even come with alarms or smartphone syncing to alert you when it's time. Just ask Patricia Lewis, 76, from Rochester, Minnesota. After missing her morning blood pressure pill 2 days in a row, she thought doubling the dose on day 3 would balance things out. That afternoon, she fainted while getting out of bed. At the ER, doctors explained that the sudden surge of medication had dropped her blood pressure too low, too fast. Patricia now uses a pill organizer and smartphone alarm to avoid ever missing or doubling a dose again. Mistake number 2. Mixing incompatible medications. Imagine taking 2 medications that your doctor prescribed, both meant to help you feel better. But together, they make you feel worse. This isn't rare. One of the most dangerous and often invisible prescription drug mistakes seniors make is mixing medications that shouldn't be taken together. Whether it's from different doctors, a new prescription that overlaps with an old one, or simply not knowing 2 drugs interact badly, the consequences can range from mild to severe, even life-threatening. As we age, we tend to collect prescriptions like souvenirs, one for blood pressure, another for sleep, a third for cholesterol, maybe something for anxiety or inflammation. Each one may be useful on its own, but together, that's where the problems begin. When medications mix, they can amplify or block each other's effects. They can strain the liver or kidneys. They can cause new symptoms like confusion, irregular heartbeat, drowsiness, or stomach pain that are mistakenly blamed on age or the condition itself. For example, combining certain antidepressants with pain medications can increase the risk of a dangerous condition called serotonin syndrome, a potentially fatal buildup of serotonin in the brain. Blood thinners, when mixed with anti-inflammatories like ibuprofen, can cause internal bleeding. Some antibiotics cancel out birth control pills. And drugs that both lower blood pressure, like certain heart meds and diuretics, can drop it too low when taken together, leading to dizziness or falls. The danger is even higher when you're seeing more than one specialist. Your cardiologist might prescribe something without knowing what your neurologist already gave you. Or your primary care doctor assumes you've updated your medication list, but you forgot to mention a new sleeping aid or supplement. This lack of coordination opens the door to harmful drug interactions, especially when changes happen quickly. Another issue is the overlap between prescription and non-prescription items. Many seniors take over-the-counter pain relievers, cold remedies, or herbal supplements without realizing they can interfere with prescription drugs. For example, St. John's wort, a common herbal mood booster, can reduce the effectiveness of antidepressants, birth control pills, and even certain cancer treatments. Calcium supplements can block the absorption of thyroid medications or certain antibiotics. And antihistamines, while seemingly harmless, can increase drowsiness or heart rate when paired with other meds. So what can you do? Start by keeping a complete list of everything you take: prescriptions, supplements, and over-the-counter medications. Bring this list to every appointment, no matter how minor. Update it every time something changes. Even if you think a medication is just a vitamin or not worth mentioning, include it. These details help doctors and pharmacists catch interactions before they cause harm. This happened to Michael Ortega, 71, from Plano, Texas. He was seeing both a cardiologist and a neurologist, and ended up prescribed 2 medications, one for blood pressure, another for migraines. He started experiencing extreme fatigue and dizzy spells. A pharmacy review found that the two drugs were lowering his blood pressure too much when taken together. With better coordination between his doctors, Michael was able to adjust his treatment and avoid dangerous lows. Mistake number 3. Not checking for drug interactions with food or alcohol. You've probably heard the phrase, "take with food" on a medication label, or maybe "do not take with alcohol." But for many seniors, those warnings are either misunderstood or ignored. And that's a mistake that can quietly turn helpful prescriptions into a health hazard. Not checking for drug interactions with food or alcohol is one of the easiest pitfalls to fall into. It seems harmless enough. You're taking your medication after all, just with your usual meal or evening glass of wine. But the way medications interact with what you eat or drink can significantly change their effectiveness, absorption, and safety. Let's start with food. Some medications need to be taken with food because it helps with absorption. Others should be taken on an empty stomach because food interferes with how the body processes the drug. Then there are foods that aren't just general obstacles, they directly interfere with how medications work. Grapefruit juice is a classic example. It can block enzymes in your gut that help break down certain medications, including statins, blood pressure drugs, and anti-anxiety medications. This means more of the drug enters your bloodstream than intended, which can lead to overdose-level effects, even at normal doses. It's not just grapefruit. Some leafy greens can interfere with blood thinners like warfarin, while dairy products can block the absorption of antibiotics or thyroid meds. Fatty meals can also affect medication timing. Some drugs need fat to be absorbed effectively. Others may become too potent when combined with heavy meals. Spicy foods might increase stomach upset when taken with medications that already irritate the gut. High-fiber foods can reduce absorption for certain pills, sending them through the digestive system before they have a chance to work. Now let's talk about alcohol. It's easy to think a small drink with dinner is harmless, but alcohol can intensify the effects of sedatives, painkillers, and antidepressants, leading to drowsiness, confusion, impaired coordination, or dangerously slowed breathing. Even medications that don't seem related to the brain, like diabetes or heart medications, can interact poorly with alcohol and cause low blood sugar, dizziness, or high blood pressure spikes. The challenge is that these interactions aren't always immediate. You might feel fine one day, but over time, the effects compound. A small glass of wine each night, combined with a new medication, might lead to sleep disturbances, mood changes, or trouble concentrating, and you'd never think to connect it back to the wine. So what can you do? First, always read the medication label carefully. Look for phrases like, "take with food," "avoid dairy," "do not drink alcohol," or "take on an empty stomach." If anything is unclear, ask your pharmacist. These professionals are trained to understand these nuances, and they can offer clear, practical advice that's easy to follow. Second, review your typical eating and drinking habits. Do you drink orange juice in the morning? Do you take your pills with coffee or tea? Do you snack late at night? All of these can influence how your body absorbs and responds to medication. A food or drink that seems perfectly normal might not pair well with your prescription. That was the case for Linda Green, 69, from Sacramento, California. She loved starting her mornings with grapefruit juice, unaware that it interfered with her statin medication. After weeks of muscle cramps and fatigue, her doctor traced the issue back to the juice. Once she cut it out and switched to water, her symptoms disappeared, and her cholesterol control returned. Mistake number 4, using old or expired prescriptions. It's tucked away in a drawer or maybe in a bathroom cabinet, a half-used bottle from a prescription you filled months or even years ago. You're feeling that familiar ache or cough again, and it seems like the perfect time to reach for it. Why go back to the doctor when the medicine is already there? But using old or expired prescriptions is one of the most overlooked and potentially harmful mistakes seniors make with their medications. The issue starts with good intentions. You don't want to waste. You don't want to bother your doctor for something you've already dealt with before. Maybe the symptoms feel the same and the label still looks legitimate. But medications aren't like canned goods. They don't stay effective forever. And more importantly, the problem you're treating might not be the same problem anymore. Prescription drugs are prescribed for specific people, for specific conditions, at specific doses and durations. When you go back and reuse an old bottle, you're assuming that everything from before still applies. But your body may have changed. Your other medications may have changed, and the original issue may not be what you think it is anymore. Take antibiotics, for example. They're one of the most commonly misused leftover medications. Maybe you had a sinus infection and didn't finish the full course. Now you're feeling congested again, and you reach for the same bottle. The problem is, not only is the old prescription likely expired, it may also be the wrong antibiotic for this new infection. Worse, taking a partial or mismatched antibiotic can lead to resistance, making future infections harder to treat. Painkillers are another concern. A leftover opioid from dental surgery might be tempting when arthritis flares up, but these medications are potent and addictive. Using them without current medical supervision increases the risk of overdose, dependency, or masking a more serious condition. Even something as simple as blood pressure or thyroid medication can become dangerous when reused without monitoring. Your current dosage needs might be different. Your blood work could have changed, and taking an old dose might tip your levels too high or too low, setting off a chain reaction of symptoms that seem unrelated at first: dizziness, fatigue, anxiety, or even falls. Expiration dates also matter. While some medications are just slightly less effective after their expiration, others can become unstable or dangerous. The chemical composition can change over time, especially if the bottle wasn't stored properly, in a cool, dry, dark place. Bathrooms and kitchens, where most people keep medications, expose pills to humidity and heat, accelerating breakdown. Another problem with using expired or old medications is that you bypass your current health context. You miss an opportunity for a doctor to assess what's really going on. That same old symptom could actually be a new issue, a sign of something deeper, or a different condition altogether. Self-treating delays proper diagnosis and treatment, and it can mask symptoms that should have triggered medical attention. For instance, Edward Simmons, 74, in Louisville, Kentucky, had kept an old bottle of antibiotics from a past sinus infection. When he developed cold symptoms again, he started using the leftover pills. Within days, his condition worsened, and the infection spread to his chest. Doctors later confirmed the old medication was expired and ineffective against the bacteria causing his illness. Edward now safely disposes of old prescriptions every 6 months. Mistake number 5, stopping medication without doctor approval. You've been taking a medication for a while. Maybe it's for blood pressure, cholesterol, anxiety, or something else that's been bothering you. After a few weeks, you start feeling better, or maybe you're dealing with some mild side effects that make the medication annoying. So you stop. Cold turkey. You don't mention it to your doctor. You just assume it'll be fine. After all, it's your body. But stopping medication without doctor approval is a dangerous move, and one of the most common and costly mistakes seniors make. It's completely understandable. We all want to feel in control of our health. When you start feeling better, it's easy to assume that you no longer need the medication that helped you get there. Or maybe the drug is causing a little weight gain, a headache, or upset stomach, and you think skipping it for a few days might give you relief. But here's the truth. Stopping medication without professional guidance can cause more harm than the symptoms you're trying to avoid. Many medications are designed to build up in your system and maintain a steady effect. When you stop suddenly, your body doesn't just pause, it can rebound. Blood pressure can spike. Mood disorders can return with greater intensity. Blood sugar levels can swing unpredictably. And some medications like antidepressants or anti-anxiety drugs can cause withdrawal symptoms that feel like illness, dizziness, nausea, irritability, or insomnia, even if you were only on them a short time. Other medications need to be tapered off gradually. Steroids, certain sleep aids, and anti-seizure drugs are just a few examples. Quitting them suddenly can shock your system. And for heart medications or blood thinners, abrupt stopping can be life-threatening, raising your risk of heart attack, stroke, or clotting. The issue is that many seniors don't see their doctor regularly or hesitate to bring up their medication concerns. They fear being judged or dismissed, or they think they'll be pressured to stay on a drug they don't want to take. So instead, they quietly stop. But when your doctor isn't in the loop, they can't help you transition safely or even know why new symptoms are appearing. Sometimes it's not even intentional. You might run out of pills and not refill the prescription, thinking it's not urgent. Or you might misplace a bottle and just let it slide. But skipping medication for days, especially if it's something like insulin, a heart rhythm stabilizer, or an antidepressant, can unravel months of progress. So what's the better path? Communication. If you're having side effects, talk about them. Your doctor might adjust the dose, change the time you take it, switch brands, or suggest a different medication altogether. There's often more than one option, but you need to ask. Make medication check-ins a regular part of your appointments. Bring your list. Be honest about what you are and aren't taking. Ask, do I still need all of these? Sometimes the answer will be no, and your doctor can help you come off the medication safely. But other times, you'll get a clear explanation of why it's still important, even if you feel okay now. Take the example of Janice Walker, 70, from Boise, Idaho. She stopped taking her cholesterol medication after reading online that it could cause joint pain. A month later, her routine blood work revealed dangerously high cholesterol levels. Her doctor explained that a dosage adjustment, not quitting, would have eased her symptoms without putting her heart at risk. Today, Janice works closely with her care team to make changes the right way. Mistake number 6, assuming all generics work the same. You pick up your prescription at the pharmacy and it looks different than usual. The pills are a different shape or color. The label says the same medication name, but there's a new manufacturer listed. Don't worry, the pharmacist says. It's just the generic. And most of the time that's true. Generic medications are safe, effective, and much more affordable. But assuming all generics work exactly the same for everyone is a mistake that can affect how you feel and how well your medications work. Generic medications are required by law to have the same active ingredients as their brand name counterparts. They're also supposed to have similar dosage forms, strength, route of administration, and labeling. But here's the catch. The inactive ingredients, the fillers, dyes, preservatives, and binders, are not always the same. And for some people, especially those with sensitivities, allergies, or complex medication regimens, those differences can matter. You might experience a new side effect when switching to a generic, like nausea, fatigue, headaches, or changes in sleep. You might notice the medication doesn't seem to work as well, or suddenly feels too strong. These changes can be subtle or dramatic, and they often go unrecognized unless you're paying attention. This is particularly true for medications with a narrow therapeutic index. Drugs where even small differences in absorption can lead to noticeable changes in effect. Thyroid medications, seizure drugs, blood thinners, and antidepressants are common examples. For these types, even a slight variation between manufacturers can impact how your body responds. Another problem is switching between generics. Pharmacies often source generics from different manufacturers depending on supply and price. So one month you may receive a tablet from Company A and the next month from Company B. Even if the medication name is the same, the formulation may behave slightly differently in your system. If you're sensitive to changes, this can create inconsistency in how you feel without you realizing why. So what should you do? First, pay attention. If your medication looks different than before, ask your pharmacist. They should always inform you if a different generic is being used. Don't hesitate to ask, will this affect how I feel? Or is this from a different manufacturer? Second, track how you feel. If a change in the appearance of your pills coincides with a change in how you feel, document it. Write it down. Bring it to your doctor. It may not be the medication itself. It may be the formulation. You can also request consistency. Many pharmacies are willing to order a specific manufacturer for you if you found one that works better. It may take an extra day or two, but it can give you peace of mind. That's what happened to Ronald Kim, 73, from St. Louis, Missouri. After his pharmacy switched generic manufacturers for his thyroid medication, he started feeling sluggish and gained weight. He didn't realize the new version, while technically the same drug, had different binders that affected his absorption. Once he switched back to his previous manufacturer, his symptoms improved. Now, Ronald requests the same brand each time to avoid inconsistency. Mistake number 7. Not updating doctors about all medications. You walk into your doctor's office for a checkup and they ask, "Are you still taking your medications?" You nod, maybe mention the big ones, and the appointment moves on. But here's the truth. If your doctor doesn't have a complete, up-to-date list of everything you're taking, prescriptions, supplements, over-the-counter medications, they're working with incomplete information, and that can lead to missed interactions, wrong doses, or even harmful treatment plans. Not updating your doctor about all medications is one of the easiest and most preventable mistakes seniors make. And it's not because you're hiding anything. It's because over time, the list just grows. A sleep aid here, a calcium supplement there, an allergy pill in spring, and maybe an herbal tea that claims to lower blood sugar. These additions might feel small, but they can interact with your prescriptions in ways that doctors can't anticipate unless they know they're in the mix. Even things like eye drops, topical creams, or nasal sprays count. They may seem local and harmless, but they can have systemic effects or interfere with how other drugs are absorbed or metabolized. Doctors make decisions based on what they know. If they're unaware you're taking an over-the-counter heartburn medication, they might prescribe something that interacts poorly with it. If you've started taking a new supplement but don't mention it, they might not connect a new symptom you're having to that change. This isn't just about avoiding problems. It's about getting the best care possible. When your doctor has a complete picture of what you're taking, they can optimize your treatment. That might mean adjusting a dose, switching medications, or even removing something that's no longer necessary. So what's the best way to stay on track? First, keep a current medication list. Write down everything you take: prescription drugs, over-the-counter pills, vitamins, supplements, herbal remedies. Even if you only take them occasionally, include the name, dose, frequency, and reason you take it. Bring this list to every appointment. Not just your primary care doctor, but every specialist you see. And don't assume that one doctor knows what the other has prescribed. In today's complex healthcare system, there's often very little communication between providers unless you make it happen. Update the list whenever something changes. If you stop taking something, add something new, or switch brands, update it. If you're tech-savvy, use a medication tracking app. If not, a printed list in your wallet or a handwritten page in your purse works just as well. Ask your doctor or pharmacist to review your list once a year, or more often if you're managing multiple conditions. A medication checkup can catch interactions, duplications, or outdated prescriptions. It can also give you a chance to ask questions about whether each medication is still necessary. And don't forget to mention non-pill treatments, patches, inhalers, injections, teas, or anything you use regularly that could impact your health. Some seniors forget that even cough drops or daily multivitamins can influence other medications. If you see a new doctor or go to the hospital, bring your list. Don't rely on memory or assume they have your records. Medication errors often happen during transitions of care, when doctors make decisions without knowing your full history, just like what occurred with Darlene Fox, 78, from Wilmington, Delaware. She never told her primary care physician she had started taking a natural sleep supplement. When she later reported fatigue and lightheadedness, her doctor increased her blood pressure meds, worsening the problem. Only when she mentioned the supplement during a pharmacy visit did the true cause emerge. Now Darlene keeps a complete list of everything she takes and brings it to every appointment. You've just learned the 7 most critical prescription drug mistakes seniors must avoid. And that knowledge alone can make a real difference in your health journey. Because when it comes to medication, it's not just about what you take. It's about how, when, and why you take it. And every detail matters. For many older adults, managing prescriptions feels like a second job. But it doesn't have to be overwhelming. By being just a little more proactive, asking a few more questions, and staying consistent with your care team, you gain something priceless. Control. Control over side effects. Control over results. Control over your peace of mind. Whether it's sticking to a schedule, checking for interactions, staying honest with your doctor, or avoiding expired leftovers, each step you take helps you build a medication plan that supports, not sabotages, your health. Because medications, when used properly, are not just pills in a bottle. They're tools to help you move, breathe, rest, focus, and feel like yourself. And the fewer mistakes in that process, the more likely you are to see the full benefit. So if any part of this video gave you clarity, comfort, or a reason to double-check your routine, then you're already ahead of the game. Don't stop here. Share this with someone you care about. Help them avoid these same traps. And let your care team, from doctors to pharmacists, know you're ready to take your medications smarter, not harder. And remember, your health isn't a guessing game. It's a process, one that works best when you have the right information, support, and plan in place. Thank you for spending this time with us. If you found this helpful, hit like, leave a comment, and subscribe to Active Healthcare for more honest, empowering health content created with you in mind. Don't be afraid to revisit this video or refer back to your notes. Use it as a checklist. Even one small change, like reviewing your medication list before your next appointment, can prevent a serious issue and lead to better outcomes. Keep learning, stay curious, and ask the questions that matter. Because when it comes to your health, the smartest thing you can do is stay informed, stay engaged, and never stop advocating for yourself. Every dose counts. Make yours count for more.